Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Mitral valve prolapse. Introduction. Mitral valve prolapse, also called MVP, is a common condition that affects millions of people around the world. If you are diagnosed with a mitral valve prolapse, it is important to be aware of certain precautions you need to take to protect the health of your heart. This program explains what mitral valve prolapse is and offers some tips for keeping your heart healthy. Heart anatomy. The heart is the most important muscle in the body. Its main function is to pump blood to the lungs and the rest of the body. The heart has two sides, the right side and the left side. Each side of the heart has two chambers, an atrium and a ventricle. The ventricles are the main pumps of the heart. Blood coming from the body enters the right atrium of the heart through two big veins. Next, it is pumped into the right ventricle through a valve called the tricuspid valve. It is called tricuspid because it has three flaps or cusps, and tri means three. The blood is then pumped into the lungs through the pulmonary valve. In the lungs, the blood is loaded with oxygen. It then returns to the left atrium of the heart. Next, the blood is pumped into the left ventricle through the mitral valve. The left ventricle pumps blood to the rest of the body through the aortic valve. Heart valves have two functions. 1. Allow blood to flow through the heart smoothly. 2. Prevent blood from flowing the wrong way. Your heartbeat can always be heard with a stethoscope. However, healthy valves open and close without making any noises that a doctor can hear with a stethoscope. Mitral valve prolapse. Prolapse is another word for when the mitral valve flaps back slightly into the left atrium after it closes. This usually happens if the flap of the valve is not the right size. An abnormality in a valve, such as the flap being the wrong size, is usually something a person is born with. The function of the heart is not typically affected by mitral valve prolapse. When the valve in an MVP patient closes, it causes a click noise that can be heard using a stethoscope. Sometimes a valve does not close all the way and allows some blood to leak back into the atrium. This is called mitral regurgitation. When this happens, a murmur can be heard right after the click. Regurgitation associated with mitral valve prolapse does not usually affect the way the heart functions, unlike other, potentially more serious valve problems. Occasionally, the mitral valve may not have as smooth a surface as a normal mitral valve, which may make it more likely to get infected. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms and complications. Most people who have MVP do not feel any pain or discomfort. Some patients feel short of breath, have irregular heartbeats, or dizziness. These symptoms are like other symptoms of heart disease and may not be related to MVP. Patients who have mitral regurgitation have an increased risk of getting an infection in the lining of the heart. This kind of infection is called bacterial endocarditis. It can cause damage or scarring in the valves. Diagnosis. Your doctor will need to take a detailed medical history and do a physical examination in order to diagnose MVP. If you have experienced any heart palpitations, chest tightness, or chest pain, you should tell your doctor. Patients with MVP or more serious heart problems commonly have these kinds of symptoms. A heart tracing or electrocardiogram, EKG, will probably be done. If needed, the EKG may also be done during exercise. This is known as a stress EKG. Once in a while, the doctor will request a heart tracing that is monitored for up to 24 hours using a portable EKG, known as a Holter monitor. This allows the doctor to detect and diagnose heart palpitations that only occur every now and then. Your doctor may request an echocardiogram. An echocardiogram is an ultrasound test like the one used to look at the baby inside a pregnant woman. It shows heart structures in great detail, including the mitral valve. Your healthcare provider may also take a chest X-ray. Be sure to tell your healthcare provider if you are or may be pregnant. X-rays are not safe for unborn babies. Treatment options. In most cases, no treatment is needed for mitral valve prolapse. For patients with mitral regurgitation, doctors may prescribe medications to lower the blood pressure. For patients with more severe regurgitation and other possible complications, the doctor will recommend more frequent follow-up visits. If needed, surgical treatment is available to repair or replace valves. On rare occasions, healthcare providers may recommend that a patient with MVP take antibiotics before dental work, surgery, or other medical procedures to prevent infections. But most people do not need to take antibiotics before medical procedures. Call your doctor if you experience any of the following symptoms of bacterial endocarditis: fever that does not go away, chills, sweating, loss of appetite. Patients with MVP can typically live a normal life with no restrictions. Like everyone else, people with MVP could develop other kinds of heart problems. For this reason, any new symptoms should be reported to the doctor. Living healthy. The following pages show the 10 most important guidelines to remember for living a healthy lifestyle. You can actually improve the health of your heart by living healthy. 1. Do not smoke. 2. Be physically active under your doctor's supervision. 3. Eat a healthy and balanced diet. If you have irregular heartbeats, cutting down on caffeine can reduce heart palpitations. 4. Check the level of cholesterol in your blood. If it is high, get it under control. 5. Check your blood pressure regularly. If it is high, keep it under control. 6. Lose weight if you are overweight. 7. Do not use illicit drugs and do not abuse alcohol. 8. Check the level of sugar in your blood. If it is high, keep it under control. 9. Get enough sleep at night. 10. Manage stress in your life. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Mitral valve prolapse is a common heart condition caused by an abnormally shaped valve. In most cases, no treatment is needed for mitral valve prolapse. Most patients with MVP live a long and healthy life without ever being affected by it. Thank you for using Explain.